Hello students, we will discuss a very interesting condition today. Just have a look what this condition is. See here, there is a swelling here, this is the umbilicus, there is a redness, edema definitely seen, but you should felt it also later. Edema seen, obvious swelling here, redness is there. So you need to ask the relevant history, duration, whether underwent any surgery earlier. You can see some scar is there, you can see this is the scar here. See that this is the scar here. Some surgery he has undergone here, and pain, fever, GA symptoms, other relevant symptoms, back pain, all those relevant history should be asked. Then you can give a diagnosis. But looking at this, what all possible diagnosis? As a spotter, you may be wrong, but you should be able to immediately synthesize your diagnosis in your brain. So it could be abdominal wall abscess, truly. Tuberculous abscess, definitely. Second is in the abdominal wall. So the things you have to remember. And after that, of course, sometimes it could be desmoid tumor. This is the other possibility. And next is dermatofibrosarcoma. That is also possibility. All those things, fibrosarcoma. All those other differential diagnosis also, desmoid tumor, dermatofibrosarcoma, other differential diagnosis also you have to think of. So what to look for? Already I have told, pain, fever, soft or firm, tenderness, clinical examination. Non-tender fluctuant means tuberculosis. Firm indurated hard area if it is secondary. So relevant history, GA symptoms, GA examination, parietal examination, other lymph node examination, then systemic examination like lungs, back examination, spine examination, all those relevant examination should be done in these patients, essentially remember. So what to do? Ultrasound abdomen, CECT abdomen, FNAC, it will give clear anatomical idea and pathological nature also. FNAC will give some idea, if there is abscess, tuberculosis, malignancy, all those things. And of course, if it is so here today, true cut biopsy, you need to do a blood test, total count, CRP, AFB for tuberculosis, or markers if it is so, if you are suspecting malignancy by taking the true cut biopsy. So finally, if it is abscess, drain it under general anesthesia. If it is tuberculosis, also drain it, but find out the focus of the GA, spine, lymph node. If it is secondary, do a true cut biopsy, do a immunohistochemistry, then find out the primary, then treat accordingly. Mostly chemotherapy, because if there is a secondary in the abdominal wall, it is rather advanced. If localized malignancy like desmoid tumor and dermatofibrosarcoma, if it is so, true cut biopsy you take, confirm it, then wide excision in the abdominal wall. You may have to place emulsion, you have to do a proper reconstruction with the help of reconstructive surgeon. So that is about this. Is a very interesting condition, remember. So you can always go through my clinical methods, SRB Mangalore surgery and operative surgery, how to do this reconstruction, placing mesh and suturing technique. Diginor lectures in detail about A to Z, everything for CBME and UGs, PGs, instrument, X-ray, specimens and so on. So students, this very interesting case, abdominal wall mass swelling. I think you have understood how to go about clinically and evaluation wise and management concept. Thank you very much.